staying strong, healthy, and youthful. By subscribing, liking, and ringing, you can greatly support our channel and help us produce more content that you'll love. Hello and welcome to the Longevity Lifestyle YouTube channel. Weight gain is a common problem that affects many people, and it can be caused by various factors. One of the possible causes of weight gain is hypothyroidism, a condition in which the thyroid gland does not produce enough hormones. In this video, we'll be talking about hypothyroidism, its symptoms, causes, diagnosis, and treatment options. What is hypothyroidism? The thyroid gland is a small gland located in the neck that produces hormones that regulate the body's metabolism. Hypothyroidism is a condition in which the thyroid gland does not produce enough hormones, leading to a slow metabolism and a range of symptoms. Symptoms of hypothyroidism. The symptoms of hypothyroidism can vary from person to person, but some of the common symptoms include 1. Fatigue. 2. Weight gain. 3. Constipation. 4. Dry skin. 5. Hair loss. 6. Cold intolerance. 7. Muscle weakness. 8. Joint pain. 9. Depression. If you are experiencing any of these symptoms, it is important to consult your doctor for a proper diagnosis. Causes of hypothyroidism. Hypothyroidism can be caused by various factors, including 1. Autoimmune disease. The most common cause of hypothyroidism is an autoimmune disease called Hashimoto's thyroiditis, in which the body's immune system attacks the thyroid gland. 2. Radiation therapy. Radiation therapy to the neck or head can damage the thyroid gland, leading to hypothyroidism. 3. Surgery. Surgery to remove the thyroid gland can also lead to hypothyroidism. 4. Congenital hypothyroidism. Some babies are born without a functioning thyroid gland or with a thyroid gland that does not produce enough hormones. 5. Medications. Certain medications, such as lithium, can interfere with the production of thyroid hormones. Diagnosis of hypothyroidism. To diagnose hypothyroidism, your doctor will perform a physical examination and may order blood tests to check your thyroid hormone levels. The most common blood tests used to diagnose hypothyroidism are 1. TSH test. This test measures the level of thyroid-stimulating hormone, TSH, in the blood. 1. If the TSH level is high, it means the thyroid gland is not producing enough hormones. 2. T4 test. This test measures the level of thyroxine, T4, in the blood. 2. If the T4 level is low, it means the thyroid gland is not producing enough hormones. In some cases, your doctor may also order a thyroid ultrasound or a thyroid scan to evaluate the structure and function of the thyroid gland. Treatment of hypothyroidism. The treatment of hypothyroidism depends on the cause and severity of the condition. The most common treatment for hypothyroidism is synthetic thyroid hormone replacement therapy, which involves taking a daily dose of levothyroxine, a synthetic form of the hormone thyroxine. Other treatment options for hypothyroidism include 1. Dietary changes. Eating a healthy diet that is rich in nutrients and low in processed foods can help improve thyroid function and manage symptoms. 2. Exercise. Regular exercise can help improve metabolism and manage weight gain associated with hypothyroidism. 3. Stress management. Stress can worsen hypothyroidism symptoms, so learning stress management techniques, such as meditation and yoga, can be helpful. 4. Alternative therapies. Some people find that alternative therapies, such as acupuncture and herbal supplements, can help manage hypothyroidism symptoms. Conclusion. Hypothyroidism is a common condition that can cause a range of symptoms, including weight gain. If you are experiencing any of the symptoms of hypothyroidism, it is important to consult your doctor for a proper diagnosis and treatment. With proper treatment, most people with hypothyroidism can manage their symptoms and live a normal, healthy life. If you have been diagnosed with hypothyroidism, it is important to follow your doctor's recommended treatment plan and make lifestyle changes, such as eating a healthy diet and exercising regularly, to manage your condition and improve your overall health. Remember that hypothyroidism is a treatable condition, and with the right treatment, you can manage your symptoms and feel better. If you have any questions or concerns about hypothyroidism, be sure to talk to your doctor or healthcare provider. They can help you understand your condition and develop a treatment plan that works for you. Thank you for watching, and we hope this video has been informative and helpful. I recommend that you watch all the videos I upload from the beginning to gain a comprehensive understanding of the topics covered. Don't forget to like and subscribe to our channel for more videos on health and wellness. See you in the next one.